My name is Sophie Atkin. I'm 16 years old, and I love music and singing and songwriting.
Sophie has been making music since the age of 7. Like many teenagers, Sophie loves to express herself creatively. Her passion is songwriting.
I love how I can communicate and express my emotions, and it really gives me a way to empathize with others.
Sophie's interests are well-rounded. She loves to perform and spend time with her friends and family.
Yeah, I love to hang out with my friends. Sometimes we'll go out for bubble tea or we'll go to see a movie. I like to hang out with my family as well.
Sophie is also a passionate speaker toward removing the stigma surrounding bipolar disorder, as she was diagnosed at age 14 and treated through the Center for Youth Bipolar Disorder at Sunnybrook Hospital.
Bipolar disorder is classified as a mood disorder, and this is a disorder with episodes of mania or hypomania, which are periods of time where someone has abnormal elation or euphoria, accompanied by other symptoms such as high energy, low sleep, and reckless behavior. And when those episodes alternate with episodes of depression, low mood, sadness, loss of interest, even suicidal thoughts, that is in the area of bipolar disorder.
When I was 14 years old, I was dealing with a lot of stressors like school and extracurriculars, and it was really hard for me to manage that stress. So a lot of that stress kind of built up, and it triggered what's known as a manic episode, which is when your mood is really high and elevated.
So imagine you can typically tolerate an hour of homework or shoveling half of your driveway, and then all of a sudden your parents wake up at 4 in the morning and they can hear you because you're not sleeping, cleaning up the entire house, doing all of your projects for the next month, and speaking a mile a minute. So there's an increase in energy that's channeled towards activity, and that's very characteristic of mania or hypomania.
Bipolar depression refers to the depressive phase of bipolar disorder.
People with depression, a relative minority will have bipolar disorder. Among people with bipolar disorder, almost all will have depression. And I think what's unique about bipolar disorder in the depressive phase is that it has a relatively narrow spectrum of severity, which means that bipolar depression tends to be treatment resistant, tends to be complex, and is something that really needs to be intervened upon early so that it doesn't become chronic.
It was a very confusing time for me. I got admitted to the Center for Youth Bipolar Disorder, which is this wonderful, amazing program at Sunnybrook Hospital, which basically kind of facilitates and gives youth with bipolar disorder a lot of help and treatment. So they have like Dr. Goldstein and a bunch of other psychiatrists with the same goal, which is how can they help and make youth with bipolar disorder have this amazing, wonderful life where they can thrive and be happy.
The patient and their family are also important members of the team. Adolescents seek independence and socialization. They must also be fully engaged in their process of healing.
So imagine you prescribe a medication to someone and then they come back with worse acne, and they have social anxiety and they have depression, and now you've given them another thing to worry about or to feel down about. And then the other thing is indirectly. So if someone doesn't like a side effect such as weight gain or acne, they may not take their medication, and now that's interfering with the likelihood that they respond to the treatment.
Medication is one pillar of therapy.
So looking at physical health targeted interventions for the dual purpose of improving mental health, and also looking at physical health metrics as an indicator of what causes bipolar disorder. So our overarching thesis of our work, our belief, is that in part, bipolar disorder is a disease of blood vessels, and that early in life this manifests in mood symptoms and cognitive problems, and later in midlife it manifests as coronary artery disease or heart attacks. And if we can use that biology and leverage it to gain an understanding of the causes of bipolar disorder, that might open new avenues of treatment that are completely off the map for us currently.
Dr. Goldstein and Sophie share a hopeful stance on the future of bipolar disorder.
The treatment of bipolar disorder presents a lot of challenges. You have mania as a concern, you have depression as a concern. Sometimes you treat the depression and you can precipitate a mania, and so I think it's one of the most complicated medical conditions that there is. Having said that, it's also a condition that in many cases has an excellent outcome. And I think that it's that rewarding experience of the possibility of having someone have bipolar disorder and not have the symptoms of bipolar disorder, so be in a full recovery, that keeps those of us who subspecialize in this area focused. And it also keeps us able to maintain a sincerely and authentically hopeful stance with all of our patients.
I think being diagnosed with bipolar disorder and just going through that experience kind of made me realize that I'm a really empathetic person. I just want to say that if anyone's going through anything, literally, if they're going through a mental illness or something within their family or their environment, I just know that everything's going to be okay.
To learn more about adolescent bipolar disorder, please speak with your healthcare professional or visit the website below.